you're breaking up that scar tissue, and you have more of these, nociception or pain receptors. As we're breaking that up, these pain receptors get reduced because the scar tissue is being eliminated and reabsorbed. And then again, as you know, there's growth factor production. There's stimulation of production of the substance P, which decreases the pain. And then the list goes on, nitric oxide production, and even lately, the research shows that it helps with stem cell production. So it's a modality that I really, after I started using this, really could not see myself not using it. I could get away with doing a lot of different things as far as not using, laser. You could, use ice and other things, or muscle stem. You could have somebody, buy a small little unit and give it to them, and they could use it at home. But the knowledge behind your anatomical knowledge that the doctor has and needs, and then with the ability to use Shockwave for what it does, it's really invaluable, because that puts me in the driver's seat to be able to really get the patient recovered much faster and healed much faster, along with the treatment that I do.
No, I mean, man, I'm really glad that you kind of walked that through, because, looking at it, sometimes it sounds too good to be true, especially when you talk about the fact that, at least from someone, from the patient side of it, right? Like you kind of, if you had any type of focused Shockwave done, especially with the actual Pisa wave, you'll go through like healthy tissue, you won't feel anything. But
right.
that breakdown of why there's possibly more of that deep, dull, achy feel over that damaged tissue is because you have more of those pain receptors there. Is that correct?
Right. That's absolutely right. Yeah. And again, unless some doctors, they have the ability to use ultrasound to see where the scar tissue mostly is, or those kind of things. Unfortunately, I don't have that available to me. But through the experiences that I've had, and through the studies that we did, and published the paper and all of that, I decided, that's what all articles that we read, I'm going to treat a tissue, an area that I'm treating, like a layered cake.
Yep.
To see, because we don't know at what depth there's, how much fibrosis, how much adhesions, how much scar tissue. So my goal is to go down to the deepest level that I know that I want to get to, whatever area it is, and I work backwards. So that's how I determine how many treatments, what depth, and so on.
What's your whole thought